Hi, good afternoon, everyone. Today our topic focus on lung cancer and also look at how ganoderma can use as a complement treatment to lung cancer. Here's a disclaimer. All the information contained in the slide are intended for general health information and educational purposes only, and are not intended to be used as a substitute for professional medical advice, treatment, or care. We now look at the statistic on cancer. Data from W.H.O. Globally, the second leading cause of death is cancer. Out of 6% who die, there's one due to cancer. In 2018, 9.6 million people died of cancer, and 18.1 million new cancer cases in 2018. So the bad news is the number is not coming down. WHO predicts a trend up that can go up to 29.4 million in year 2014. Of all the cancer cases, most common type of cancer is lung cancer. The top 5 cancer cases in 2018, as you can see from the chart, from stomach cancer, prostate cancer, colon cancer, breast cancer, and the highest is lung cancer, which stand at 2.09 million. As for the top 5 cancer deaths in 2018, you can see the number: breast cancer death, liver cancer death, stomach cancer death, colon cancer death, and the highest is still lung cancer death, and it stands at 1.76 million. Now we look at the data from SingHealth Singapore. Lung cancer is number 2 killer in men and number 3 killer in women. And the data collected between 2011 to 2015, about 1,004 new cases every year on average. Next, we look at the anatomy of lungs. We have 2 lungs that are spongy organ located in the chest, and the base of the 2 lungs are supported by the diaphragm. They are not identical. Left lung has 2 lobes and right has 3. Left lung is a little smaller because it needs to share space with the heart. The main function of the lung is to bring in oxygen to our body and take the carbon dioxide out from our body. When we inhale, our lung expand and let the air in from the nose and mouth. Air will then travel along the trachea, which is a windpipe, to bronchi, breathing tube, and enter the lung. In the lung, the breathing tube will then further split into many smaller branches of tubes called bronchioles. All branches of tubes will eventually end with an air sac balloon type called alveoli. We have about 600 million of these alveoli. And this alveoli is like a small balloon, and it is where the main air exchange takes place. Oxygen at that point will then release to the bloodstream. So in exchange, the carbon dioxide from the bloodstream will then move to the alveoli. When we exhale, the lung contract and push the carbon dioxide out through the same breathing tube. On average, we breathe in and out about 23,000 times every day. Our body has many organ systems. Lungs belong to a system called respiratory system. From nose cavity, mouth, throat, windpipe, breathing tubes to lung, all these organs that involve in breathing is under respiratory system. within the respiratory system, it is further classified into upper and lower respiratory system. Use the throat as a divider. Above the throat level is upper respiratory system. Below the throat is lower respiratory system, which include windpipe, breathing tube, and lungs. Next, we look at the overview. What is lung cancer? Lung cancer originates from tissue of the lung, usually from cell lining the air passage. And lung cancer is the uncontrolled growth of abnormal cells in one or both lungs. And these abnormal cells do not function as a normal lung cell. So it started when abnormal cells grow out of control in the lung. Next, we look at the difference between primary lung cancer and secondary lung cancer. When cancer cell started in the lung, is considered as primary lung cancer. But when cancer cells in the lung are actually spread from other organs, this is secondary lung cancer. Knowing the difference would allow the doctor to have the right treatment. So for example, in the case of breast cancer cell metastasized to lung, this is secondary lung cancer. So doctor will give the treatment for breast cancer. Next, we look at the type of lung cancer. There are two types of lung cancer: non-small cell lung cancer and small cell lung cancer. And non-small cell lung cancer is the most common type of lung cancer. Within this non-small cell lung cancer, they split into three subtypes. Adenocarcinoma, which is the most common type, 50% of it. Squamous cell epidermoid carcinoma, this is the second most common, which stands about 30% from this group. And the last one, least common type, is large cell undifferentiated carcinoma. The characteristic of this is they grow slower. Small cell lung cancer is the not so common type. 10 to 15% of all lung cancer belong to this. But the characteristic of this is that it grows rapidly, very fast, and spread early to other organs. So once this type of cancer is diagnosed, further scan to determine if the cancer has spread to other organs. Next, we look at the staging of lung cancer. For non-small cell lung cancer, there are 4 stages, and the number indicates that how far the cancer cell has spread. Example, stage 0 is localized, and stage 4 is that it spread further out of the distant organ. Small cell lung cancer, as for small cell lung cancer, there are 2 stages: limited or extensive. Limited is localized, and extensive means it spread further out, distant organ. Here is the picture, show that all the stages of lung cancer. Non-small cell lung cancer stages. Stage 1, as you can see in the picture, is localized. Stage 2 is still localized, but it spread to the lymph nodes, nearby lymph node, still within the area. And stage 3, there are 3A and 3B. 3A is on one side of the lung. 3B is that it spread to the opposite lung. Stage 4 is that it actually spread out of the lung to distant organ. For small cell lung cancer stage, limited is localized, and sometimes maybe spread to a nearby lymph nodes. And extensive means it's actually spread out of the lung to distant organ. Next, we look at the symptom. Patient may generally have weakness, feel tired, and sometimes unexplained weight loss, and they also feel no appetite at times, loss of appetite, and they have persistent cough, and it gets worse over time, recurring chest infection and fever, sometimes complain about chest pain and back pain, and this is constantly having this type of pain, shortness of breath, wheezing and hoarseness, and cough out blood in the sputum. And quite often lung cancer is detected at the later stage, because of many of these lung cancer do not show symptom until the cancer is at the very advanced stage. So next we look at the risk factor. Who are the people that at risk? Smoker, those who have cigarette smoking, exposed to second-hand smoking, exposed to harmful toxic chemical asbestos, and family history of lung cancer. So another group is that they don't have all this, but they still get lung cancer. So the next group is gene mutation. It is called EGFR mutation, epidermal growth factor receptor, and this EGFR is a protein in the cell that bind another protein, EGF, epidermal growth factor, that helps cell growth and divide normally. Both EGFR and EGF are part of a normal and healthy cell. When there are too many receptors caused by this mutation, the cancer continues to grow and divide uncontrolled. Next, in these two articles from Singapore newspaper, the Straits Times, published in 2016, the report says that doctor and researcher were puzzled as to why people who don't smoke also can get lung cancer. And both articles show the research it is due to EGFR gene mutation, and but as to what causes mutation is still unknown. So prevention, what can we do? Stop cigarette smoking if you are a smoker. Stay away from second-hand smoke. Avoid exposure to toxic chemical. Eat healthy diet and exercise regularly. And next will be go for screening. And screening is good because if cancer can be detected early, there will be higher chance of survival. And especially for high risk group, yearly screening would be good, because symptoms may not show in the early stage of lung cancer, but sometimes we may mistaken that the symptom with other health problem. Also, sometimes when symptoms appear, cancer may be in an advanced stage. Next, we look at the diagnose. Chest X-ray, sputum cytology, which means they examine the mucus under the scope to look for the cancer cell. And bronchoscopy is that insert a fiber optic tube. There's a flexible tube through the nose into the airway. Imaging study, CT scan, MRI, and PET scan. Transthoracic needle biopsies. With CT scan guidance, a needle is inserted into the chest to biopsy suspicious lumps in the lung. Next, we have video assisted transcoscopic surgery. This is an invasive procedure similar to bronchoscopy, but the scope now is inserted to the incision to the neck for checking if the lymph nodes are affected by cancer. This test may be needed if all the earlier tests do not give a conclusive result. So the treatment plan depends on the lung cancer type and its stage, whether it's spread, if it's spread, which area is spread to. For lung cancer, it tends to spread to lymph nodes, brain, bone, liver, adrenal gland. And ultimately, the treatment goal would be cure the disease, control the disease to prolong life, or to prevent the complication and improve the quality of life. These are the common treatment type: surgery, chemotherapy, radiotherapy, targeted therapy. For surgery, cut into the body and remove the tumor. So the advantage is that higher chance of cure if the cancer has not spread. But the drawback is surgery risk. Next is chemotherapy. So this will be using the drug to kill the cancer cell. And the problem is the normal cell will be affected as well. And the other drawback, it would be the side effect of the drug. Example like low blood count due to bone marrow suppression. And next is the radiotherapy. This method uses high energy particle to kill the cancer cell at a specific location. The drawback will be fatigue, skin color change, and appetite loss. As for the targeted therapy, they will use the special drug as it can precisely identify and kill the cancer cell. So for this one is that they just little damage to the normal cell. Targeted therapy has been used for non-small cell lung cancer patient that is related to gene mutation. But for the drawback would be some new drug can be quite costly, and also the side effect of it. Next, we talk about consumption of health food. During the chemotherapy treatment, our body needs to be strong and in good shape to handle all the new drugs. So a good number of health food can be considered, especially those that has the ability in regulating our physical constitution and immunity, as it lay the foundation to control the growth of cancer. And ganoderma or 灵芝 would be a good choice to take as supplement. This because it has been regarded as top grade health food in enhancing health. Next, we will look at why ganoderma is a good choice. Major component of ganoderma, there are 4 major components: terpenoid, micromolecular polysaccharide, ganoderma nucleotide, and LZ8 protein. It is because of all these major components of ganoderma that make it so unique for the benefit. With this component, the benefit will be modulate immune system, improve liver function, improve blood circulation, and clear the free radical. For modulate immune system, as we know that immune system cannot be too high or too low. Under chemo treatment, immunity will be suppressed. So ganoderma can regulate and bring the immunity system up to the optimal level. As for liver function, liver acts as the toxic factory to remove all the waste toxin product. Hence, liver function must be in good shape to handle all the toxin at this time. This is very important, that the uniqueness of this ganoderma component can improve the liver function. Next, improve blood circulation. During this time, we need oxygen and nutrient to be able to transport to all the organs effectively. So we need to have good blood circulation. Next will be the next benefit will be clear the free radical. Next we'll look at how ganoderma in assisting cancer treatment. Ganoderma assists the cancer treatment in two approaches. One is to stop the cancer cell from growing and spreading. Two is to supplement the treatment, supplement the chemo and radio treatment. First, prevention of cancer cell proliferation or metastasis. How they do it? They by induce apoptosis and to kill cancer cell directly. The other one will be, with this is that it increase the patient surviving rate. Next will be supplement treatment to chemotherapy and radiotherapy. The benefit is that it provides antioxidation due to free radical cell, enhance the stimulating mechanism due to bone marrow suppression, and at the same time protect the liver due to toxin of drugs, and reduce the side effect of chemo and radiotherapy. Want to know more about the evidence of ganoderma on cancer treatment? You can do a Google search, look for ganoderma and cancer. As of 30th July 2020, about 900 specific scientific papers on this subject have been published in the PubMed. PubMed is the database on life sciences and biomedical topics. Next, we'll look at the research and technical paper. Prevention of cancer cell proliferation or metastasis. In this experiment, they are looking at two actions, direct and indirect action. And the researcher give ganoderma to the cancer mice and see how this ganoderma component can stop the cancer cell from spreading and growing. So the focus on this is on two major components of ganoderma, terpenoid and polysaccharide. So based on this experiment, the results show that these two components have two different actions in stopping the cancer cell, a direct and indirect method. Terpenoid inhibit new vessel formation in a direct manner. So which means they they don't kill the cancer cell directly, but instead they stop the cancer cell from growing new vessel, as opposed to the indirect action of polysaccharide, which they first strengthen the immune molecule that later inhibit the new vessel formation, thereby indirectly stop the cancer from growing. So from this experiment, it also shows that the dosage must be high in order to have the prominent effect on the tumor tissue inhibition. So high dose will have a prominent effect based on this experiment. Next, we look at the supplement treatment to chemotherapy and radiotherapy. This is the clinical experiment on cancer patient, and from the result, it shows that ganoderma able to modulate the patient's overall immune system, enhance their body anti-cancer ability, and also raise their tolerance to chemotherapy and radiotherapy. They also observe another benefit, that is, life can be extended for another 3 to 6 months or even longer, and at the same time reduce the side effect of the chemo and radiotherapy. And the result is based on taking 5.4 grams of pure polysaccharides, which is equivalent to 2 bottles of Yonkin 1 daily for 3 months. So dosage and duration is a key factor on this. Next, we look at the multi-drug resistant on adenocarcinoma lung cancer, which is the most common type of lung cancer in non-small cell lung cancer. Multi-drug resistant, also called MDR. What is this? This is a condition when earlier effective chemotherapy or targeted drug lost its effectiveness after a prolonged use in a patient. So they have done a study to find that in the animal test, the dosage of this drug can be increased to overcome this MDR effect, but it is not possible to be done on human body due to its toxicity. We can't just increase the dosage for human. So the normal practice would be using another type of chemo drug to handle this MDR situation, but the new drug will eventually also develop into the MDR itself. So there are limited choices of method or chemo drug used for this cancer treatment, especially for late and last stage of lung cancer patient. So MDR condition become even more challenging for lung cancer treatment, and meaning many cancer develop resistance to chemotherapy drugs, and this is the major factor in the failure of many forms of chemotherapy treatment. Next, we will look at the study on ganoderma component GTE. So this is mainly the tretopinoid to use together with the chemo drug doxorubicin to prevent adenocarcinoma type lung cancer. So this experiment done on two sets of mice, one with the MDR adenocarcinoma cancer H22/0.3 type and the other with non-MDR cancer H23 type. So the MDR type is with the /0.3, then the non-MDR is without, it's just the H23 type. So how stubborn is this MDR type cancer cell? So they would like to see how stubborn it is. So study found that the MDR type need 60 times more drug dosage than the non-MDR type to achieve the same target of 30% reduction in the cancer cell after 72 hours of this so-called, they did a measurement. So next is the and the drug dosage used for the non-MDR is 0.05 microgram per milliliter, and the MDR type they require 60 times more, 3 microgram per milliliter of drug in order to shrink the same 30% cancer cell. So next we look at another experiment. They include ganoderma together with the drug, also actually experiment on the two sets of mice, MDR and non-MDR. So now the target is that they want to reduce 50% of the cancer cell, and this experiment, the results show that the chemo drug dosage used is about the same when tretopinoid is added. So the drug dosage for non-MDR use is 0.29 milligram per milliliter, and the MDR type used is 0.34 milligram per milliliter. So 0.29 versus 0.34 is not a significant difference, which means when added with tretopenoid on the same drug, on these two types of cancer, they achieve the same result. Hence they conclude that the effectiveness of this ganoderma tretopenoid on adenocarcinoma will not be affected by the MDR type of cancer cell. In other words, whether adenocarcinoma cancer is an MDR or non-MDR type, the effectiveness from this ganoderma is still the same. So next study is on ganoderma together with the chemo drug 1+1. Okay, so another study focus on the dosage, just on this one we focus on just on the MDR only, but the setup is a little different. So the first experiment is a standalone test, meaning they take ganoderma and cancer drug as a separate standalone treatment on MDR, meaning they will take tretopenoid test on MDR, and then another test is that cancer drug alone test on MDR. So this is the first setup. So for second setup, they combine both. It's a combined test. They put tretopenoid GTE and a cancer drug together and test on MDR cancer cell. So they found that for standalone tests, the tretopenoid GTE alone on the MDR cancer achieved 14% reduction. As for cancer drug, it achieved 18%. But for combined tests, it achieved 78% reduction of the cancer cell. So from the experiment, it showed that the effectiveness of this both tretopenoid with cancer drug, they can have a much higher suppression on cancer cell, just compared to just use ganoderma or chemo drug alone. So you look at the chart, you can tell that ganoderma group alone, without a cancer drug, is achieved 14%, and if you use chemo drug, you only achieve 18%. So combine both together, they achieve 78%. So next is on another study on tretopenoid for mice with MDR. So they have these mice with MDR cancer. Just for this experiment, they only focus on the tretopenoid on MDR. So they have these mice with a cancer cell, MDR cancer cell, and the cell has the volume size of 50 millimeter cube volume size, and they split into two groups for this control group, so that one without any treatment, the ganoderma tretopenoid group, they give them the treatment using ganoderma. So for this ganoderma group, GTE group, they fed them with GTE tretopenoid continuously for 45 days. So after 45 days, they look at both group result, and the mice without any treatment, the cancer cell grow to 2000 millimeter cube volume size, and as for the GTE ganoderma group, the cancer cell only grow to half of the control group and has less cancer cell activity. So in summary, the terpenoid, the GTE group, achieve the effectiveness in the treatment of MDR, but this is done on the animal study, and the expectation will be reduce the size of cancer cell, reducing the growth rate, and even to the stage of making the cancer cell disappear. So they will have further study on this. So next we talk about the testimonial. So this is the Madam Hu from Taiwan, had stage 4 lung cancer at 94 years old back in August 2011. So the symptom is difficulty in breathing and keep on coughing, and doctor said 6 months to live, and later found that it's a EGFR gene mutation, so they prescribed target chemo drug Irisa, and did chemo for 3 days, but there's water still remain in the lung, condition still not improved. So after the 3rd day, they use chemo with 8 capsule 灵芝 together with the chemo drug, and condition improved, and she discharged on the 7th day, as the water in the lung had reduced significantly. So continue with the ganoderma, taking 8 capsules of ganoderma plus together with Irisa for the next 3 months, and lung condition has improved a lot, and subsequently they reduced to 6 capsules of ganoderma daily. So after 6 months, did a quarterly medical review, show that the lung is in good condition. Yeah. So next, another testimonial, Madam Lui, also from Taiwan, diagnosed with stage 4 lung cancer at 64 years old. So the symptom is breathless, body, shoulder aching, and also sudden weight loss. And start 30 capsules per day before the chemo, and having stomach pain and diarrhea as the vertical reaction. Other reaction is that the aching reduced only after 1 month. So taking 40 capsules daily during chemo together with the chemo drug, and having side effect, no side effect, and good energy level and appetite. So after chemo complete, she reduced the ganoderma to 20 capsules a day, and after 1 year, the cancer cells surprisingly spread to the bone due to EGFR mutation, and continue taking the ganoderma, now take with 30 capsules daily together with the targeted drug, and lung cancer has then improved and continue with 30 capsules daily. So in summary, ganoderma 灵芝 help together with chemo treatment to prolong life, and also reduce complication and improve the quality of life. So during treatment, we should also consider other stronghold product in our daily needs, as it has the nutrients our body need. So this is example our W.H.O Yongkian pollen, which contain many of the nutrients our body need. It has 16 vitamin, 16 mineral, 21 amino acid, 28 nucleic acid, and 94 enzyme and coenzyme. The key benefit will be regulate nutritional imbalance, fortify our immune system, enhance absorption of 磷脂. Another good product is W.H.O W.H.O soya protein powder, as one of the ingredients is soya bean, which has anti-carcinogen effect that can help to lower the risk of cancer. Also, in one of the study from Hong Kong, show that lung cancer risk can be cut by half. Yeah. So next conclusion would be cancer is still one of the most dreaded disease, especially lung cancer. 磷脂 ganoderma is one of the best health food to prevent and also complement treatment on cancer, including lung cancer. So it enhances the immune system. Use 磷脂 together with surgical removal, chemotherapy, radiotherapy. All this is effective in improving the condition. So other W.H.O products such as bee pollen protein powder can be consumed as part of the balanced diet. Yes, with that I end my presentation. Thank you.